So our first communication is it's an apology scenario about the medical error. That is a child admitted in our hospital. John. John is a 8-year-old boy. He admitted for the anaphylaxis, but mistakenly nurses given her adrenaline IV instead of IM. There is swelling on his hand develop. Now you have to talk with the mother about this apology you need to tell. Okay?
Okay,
So you can start or you can take time.
I can start.
Well, start.
Hello, good afternoon.
Yeah, good afternoon.
I'm Dr. Teresa, one of the child doctors. I believe I'm talking to John's mom.
Yes, I'm
Okay,
John
can I?
Moms.
Yeah, nice to meet you. Can I know your name, please?
Yeah, I'm Mira.
Okay. Mira, thank you so much for coming to see me today. How is John?
Yeah, John is, improving. He has anaphylaxis occur. You guys treated. I think he's improving.
Okay, that's really glad to know that. I'm here today because I want to discuss about one conditions. I want to admit that while taking care of the John, there has been some mistake happen, and I just want to expose that mistake to you. Is that time suitable for you to have these discussions?
Yeah, yeah, of course.
All right. So Mira, John's has been admitted with anaphylaxis, as you've mentioned. So, during the taking care of the Johns, instead of giving one drug called adrenaline into the muscles, um,
Hmm.
we have wrongly given the medication
What?
into directly into the vein.
What were you telling, doctor? Do you lost your mind? What type of talk you're talking? So who did this mistake? Just tell me this stupid name. I want to know.
I understand that as a mom, it must be shocking to you. Your feeling is completely understandable, but sometimes mistake happen not because of one specific person's. So I cannot tell you exactly, who is the one person's responsible. It is all our team responsible for that mistake. But our worry is to John's, and luckily John's, apart from having swellings because of these round injections, John is currently stable, and that is what we are really glad for that, Mrs. Mira.
I understand, doctor, everything, but I know that you are defending your colleague. Just I want to know this culprit name. First, tell me.
Mrs. Mira, it is not like I'm defending. Well, it is like as if you have been working as a team. Mistake is not because of one specific person's. It can be because as it is an emergency situations. This mistake can be so many others. So many others artifacts causing to this mistake. But what we are gonna do is that we are gonna write the incident report, have a meeting, arrange a meeting with all the consultant seniors, all the responsible persons. We will discuss why that happened and why how we could prevent that to happen that in the futures.
Okay, doctor, I understand that. But what about my John condition? Is he now going to die? What you are doing for him? Do you have given the antidote?
Miss Mira, you are very kind and caring moms. John's is not gonna die, but because this medication has been given wrongly to the veins, it just causes problems with swelling. So Jones might have a little bit pain into the arms where the medicine has been injected. Apart from that, Jones has been stabilized from her anaphylaxis reaction because of that medications. We have stabilized his conditions, and he is not in danger, Mrs. Mira.
Okay, okay, I understand. Just I
Uh,
don't I just want to leave this trust and to take my child to the another hospital.
I understand that we totally respect your decisions, and I totally understand that at this stage you might have that kind of decisions. But let me explain to you again. This mistake has been happens and intentionally. We truly doesn't want that to happen to John's. In fact, we are working hard to save the life of John's, but unfortunately during the times of emergency mistake has been happened. And if you can change your mind, you can let me know, as we are already open to take care of John.
I am static on my mind. I want to leave these hospitals. Just give me the discharge paper.
Okay, I will discuss with my seniors, and I will discuss whether John is safe at this time to leave the hospital to transfer to the new hospital. How does that sound to you, Mrs. Mira?
Okay, okay. Now I want to complain against you.
Okay, I can understand your worries. You can have a complaint. We have a service called PAL service, Patient Advisory Liaison Service. I can give you all the detailed information how you can make a complaint regarding that matter to that. Okay, Mira.
Yeah, I understand that.
Thank you so much,
Okay.
Mrs. Mira, and thank you so much for your
So
understanding.
what are the steps you are taking for management of my child?
Pardon, which management did you say?
Now for stabilizing him,
All
what are
right.
the steps you
So
have taken?
we have already stabilized with the requires medications. However, the swellings that happened after the injection of that medications, we are gonna relieve the pain with the painkiller medications. And if there is a cannula inserted, we will remove the cannula, and we will give the cold compress to that arms in order to relieve the swellings of John's.
Okay. Okay, okay.
All right. Thank you so much, Mrs. Mira. Any questions you have at this point?
No, I have no any questions.
All right, thank you. So I will have a chat with my consultants just to make sure whether John is ready to transfer to the next hospitals or not, and I will let you know. Okay.
Okay.
Thank you. Bye
So you
bye.
have to summarize, you have to give me trusted website leaflet. You need to
Yeah.
again tell me I'm really sorry, okay, at the end.
Mm. Yes.
So okay, you have done, but what happened when I told you that she's gonna die? What it will do if we give adrenaline IV? It is 10
Mm-hmm.
times more higher dose than I am. Number one.
Mm-hmm.
Number two, you don't
Yeah.
know what management we are doing. That is what happened. If John has received the higher dose of adrenaline, he may have higher rate of the heart rate and may affect his blood tube in the hand. So we'll keep
Mm-hmm.
monitoring his heart rate, blood pressure, and the temperature. Are you with me? And also we'll involve the heart doctor and doctors specialized with the blood tubes to discuss with him if he gonna give him any medicine to dilate or widen the blood tube. So there is blood tube is constricted. So blood tube specialized doctor will come. He will decide he needs to give the medicine to dilate the blood tube or not. Number one. This is management, heart doctor. We are monitoring heart rate, blood pressure, respiratory rate. And another thing is that when I told you that I want to go another hospital, you have to tell me that John is stabilized, but we need to till monitor a few hours and
Mm-hmm.
for completely stabilization him. And also I need to talk about my consultant with this matter because he is the one who can discharge John. So I want to practice this. You the examiner, I am the role player. Okay.
Okay. All right.
So I am starting.
All right.
Just a minute. Hello, good afternoon.
Good afternoon.
I'm Dr. Sultana, one of the children doctor in this hospital. I believe I'm talking with Mira, mother of John.
Yeah, I'm Mira, doctor.
Thank you very much for coming here today. And today I'm here to talk about John's health conditions. But before I start, is that a suitable time for you to
Yeah,
conversation this
yeah,
matter?
yeah, yeah.
Okay.
It's better. I a bit worry. What's happened to my John's hands?
Ma'am, thank you very much. I'm here to answer our questions. So, ma'am, before we start, do you want anyone to join this meeting or shall we start?
No, no, no. You can talk to me. Yeah.
So, ma'am, can you please tell me what is your update about John's health condition?
Jones has a problems with peanut allergies, and he suddenly developed loss of conscious. They called as anaphylaxis. So Jones, the doctors there has been taking care of them, but John is currently stable. However, I'm really worried. My John's hands has been swollen, and what's wrong with my hand, with the hands of my baby?
Yeah, yeah, ma'am. I understand that it's really honor to sit like a keen mother to you. But ma'am, I'm really sorry. I want to tell you something. I'm apologizing from me, myself, and my team that a medicine that called adrenaline, mistakenly we give you the blood tube instead of the muscles. Ma'am, I'm really
Oh,
sorry for this
pardon,
occurrence.
pardon. Can you repeat it again? What did you say?
I told you that mistakenly we have given a medicine that is adrenaline called in the blood tubes instead of the muscles.
Oh, that is totally negligent. How you guys? Oh, how could I take? How could I be safe in the hospital? Oh no.
I think your voice is repeating. I don't understand your voice. Okay,
Okay,
again.
that
Hmm.
is really really unacceptable. Who did this mistake? Tell me the name of that doctor.
Ma'am, I understand that you are upset, but it is not a single person made a mistake. It's just a mistake of the events, series of events. I can say that. So, ma'am, not a single person mistake.
Oh, again, you guys making a mistake, and then you don't want to show up that this person has been responsible. They're not. That means you're not accountable for the mistake. What's happened to my John? So what happened because of this problem?
Ma'am, I understand your feeling completely. What happened? This medicine actually, when we give it is on the blood tubes, it is 10 times higher dose than the muscles. But I want to tell you, reassure you that John is still stable now, and we are monitoring his conditions like his heart rate, blood pressure, temperature. Everything is our control. He's still stabilized, ma'am. And also, I want to tell you, ma'am, that we are monitoring his heart rate. If needed, we will involve heart doctor. We will, if need, blood tube specialized doctor. We will involve him. And he will take the decisions that John's need any dilation of the blood tubes medicine or not. Am I clear so far, ma'am?
Yeah, you are quite clear, but I think that that is quite negligence, and doesn't the hospital teach proper training to the head professionals that this medication should not be go into the veins? What happened with my hand, the hands of my John, the swellings? How will you manage the swelling?
Yeah, ma'am. I understand that. Actually, we are treating him. We are monitoring, observing his swelling. We are giving all the treatment what need, and the swelling actually goes with time. So it needs time to go with that. Okay, ma'am.
Okay, all right. But I still am not happy that I'm not safe taking care of my child. That kind of negligence, poor service hospital. I will make a complaint. I will leave that hospital soon.
I'm really feeling sorry that you think like that way, ma'am. And I want to tell you that this is the best hospital for John, and we are familiar with John's conditions. And John is also being comfortable with us. So I think, and also, ma'am, we are doing lots of steps for that reasons. We are double checking the medication before giving. We add fluorescent marker, and also, ma'am, we already update this. Critical incident report we feel we update it our weekly meeting, and also we involve our practice manager. Okay, ma'am, I'll tell you
I
the
don't.
update.
I don't care what will do, what your hospital management will do. What I care is that I'm not safe taking care of my baby here anymore, and there is total loss of trust between we and your hospital teams. I want my child just to leave from your hospital team.
Ma'am, I'm really sorry you think like that way. Yes, ma'am, it's your complete right, but I have to take some hours because we need to completely stabilize John, and I need to talk about this matter with my consultant because he's the one who will give the sign the discharge paper. Am I making self clear?
Okay, all right. And then I will complain to all of you that this mistake has been happened because of all of your negligence.
Sorry, ma'am. And okay, ma'am, it's your complete right. If you want to complain, I will guide you through the pulse, that is patient advice and liaison service, that will help you and update you about this matter. Okay, ma'am.
Okay, all right.
So, ma'am, have you any concern in this matter?
No, no, not anymore. Thank you.
So, today I have discussed lots with you, ma'am. So, may I summarize for better outcome what we discussed today?
Yeah.
So, ma'am, today I'm here. I'm again telling I'm really sorry from my team and myself that mistakenly medication that is adrenaline I have given. We have given from the blood tubes instead of the muscles, and we John still stabilized, and we are monitoring his conditions. All the management plan. I also guide you about the complaint, pulse, everything in this matter. Okay.
All right, okay.
So, ma'am, I'm giving you some trusted website and leaflets in this matter of adrenaline medications, and that will be helpful, and you will get lots of information in this matter. So, how does that sound, ma'am?
Yeah, it's fine. Perfect. I will leave this hospital soon.
Okay, ma'am. So, ma'am, thank you very much for your time, and I wish John's recovery soon. Okay.
Okay. All right.
Yeah, you're welcome, ma'am. And if you have any questions in any doubt, anything, you can ask me and come me. I will give you the answer. We are here for helping you.
All right. Okay.
I think 1 minute 30 second, like 30 40 second remain.
Uh, uh,